IBG News Business Leaders Series. News read by Mirai. As reported and photographed by Miss Rinika Munshi. Kolkata, 8th June 2022. Gufic Biosciences eyes to grab major share of 3,000 crore rupees lyophilized antibiotics antifungal market in India. Gufic Biosciences has launched new drug delivery system, dual chamber bags at affordable price first time in India, and it aims to capture a dominant share of the high demand in this particular segment. Kolkata, 8th June 2022. Gufic Biosciences Ltd, a fast-growing pharmaceutical player recognized for its innovative, high-quality pharmaceutical and herbal products, and has targeted to capture major share of 3,000 crore rupees lyophilized antibiotics antifungal market in India. Known for its innovative and high-quality pharmaceutical and herbal products, along with a wide range of APIs, Gufic Biosciences has launched new drug delivery system, dual chamber bags at affordable price first time in India. The launch event was held in the auspicious presence of Mr. Pranav Choksi, Executive Director, Gufic Biosciences Limited, Dr. Ajor Krishna Sarkar, Clinical Director of Intensive Care, Peerless Hospital and Research Center, Dr. Narayan Banerjee, Senior Consultant Physician in Internal Medicine, Director, Zenith Super Specialty Hospital, Dr. Soren Panja, Director, Critical Care, Narayana Hridayalaya and Professor, Dr. Bibu Kalyani Das, Director Critical Care, Institute of Neuroscience. Contributing immensely to the government's ambitious Make in India drive, Gufic Biosciences has collaborated with its French counterpart to manufacture this new technology indigenously in India. Until now, the dual chamber bags have been largely imported and used to cost very high to the patients. On the contrary, Gufic Biosciences has not only launched high-quality dual-chamber bags at an affordable and pocket-friendly price, these new drug delivery system products have even longer shelf life. Dr. Debesh Das, Ku, Gufic Biosciences Limited said, "We are committed to reduce the country's dependency on imported products, especially in critical care segment. Moving ahead with this vision, we have launched indigenously produced dual-chamber bags of global standards in India at a pocket-friendly price. As we are experiencing rapidly growing demand for our product, we look forward to grab major market share in this particular segment." These dual-chamber bags launched by Gufic Biosciences are two-chamber 4 bags made up of polypropylene, DHP-free, with a peelable aluminium foil allowing the storage of unstable drugs which need a reconstitution just before the administration to the patient. The peelable seal separates lyophilized or powder drug and its diluent. Moreover, the product complies with the US and EU pharmacopoeias, and it is manufactured in ISO 7 clean room under CGMP. Features and benefits of dual chamber bags, DCB, by Gufic Biosciences. It reduces risk of bloodstream infections and thereby ensures patient safety. Stability of the drug is much more in DCB rather than vials, as it provides complete protection from light and moisture. The bag's closed system ensures that the product is sterile and avoids risks of contamination during handling. No nitrosamines used, no risk of cancer in diverse organs and tissues. DCB, tubing and twist of port are DHP-free, no risk of cancer, birth defects and other reproductive harms. Glue-free eradicates the risk of interaction with drug product. Prefilled with intended dosage and diluent into separate bags, accurate dosing, easy handling, seal integrity and high stability. Individualized treatment regimens avoids hospital contamination and provides high stability and convenience, thus significantly improving product quality and patient compliance. Provides high stability, avoids leachability, free of airborne bacterial contaminants and needle stick injuries. One of the most important USPs of these ready-to-use dual-chamber bags by Gufic Biosciences is that they prevent contamination and protects the potency and efficacy of the drug. These bags also offer ease of handling at the time of reconstitution and also help in avoiding the dilution errors since the drug is present with the exact required quantity of the diluent to be used. It can be reconstituted just before administration by simply peeling off the aluminum foil and folding and squeezing the bag, thus the diluent enters the drug chamber and mixes with the drug. It is then directly administered as 4 infusion to the patient with the help of 4 tubes. Recognized as one of the largest manufacturers of lyophilized injections in India, Gufic Biosciences has a fully automated lyophilization plant. The company's lyophilized product portfolio includes antibiotic, antifungal, cardiac, infertility, antiviral and proton pump inhibitor segments, among others. Its products are supplied to all the major hospital chains and leading medical facilities.
If you consider about the accuracy, safety, efficiency, all these things, I think this will definitely and kind of new innovation which is available in India, and particularly India where the chance of infection, particularly the hospital-acquired infection, sometimes the blood stream infection is very high. And really we are not only, the whole world is right now struggling with the health-associated infection. I think that this technology as well as application will definitely bring down this problem. So that is, and not only that, along with that, I think error-proneness, because the medical, when we are treating the patient, there is definitely chance of error, because ultimately human being is going to basically create some error, and that is bound to happen, whether it is the percentage maybe 1%, 2%, 3%, but ultimately the patient will be the sufferer. So from the safety point of view as well as outcome of the patient, I think must be definitely improved with this application of this technology, and I think we should definitely adopt this technology, and in the already we have come across with other technologies that they are coming up in the future. So I hope a lot of patients will be benefited from these technologies. And I congratulate and thank all the team members as well as media who are participating to cover this area. I think that will also bring us a change of ethics. With this, I will thank you all.
I won't go for details of everything, but one thing I find is very important that when you are giving antibiotic, you have to have the exact dose and that should go into the system. The problem with our previous delivery system, the vials, they are not lyophilized. What is the difference between lyophilized and non-vial? In a normal vial, if you keep any molecule, it will stick to the wall. You will find that previously many injections are having white wall, and that means if you stick them, you won't find that it's coming down. So these vials are not lyophilized. Lyophilized vial will have all the product will come down, and there will be a clear wall, glass bottle, whatever bottle. Second thing, when you dissolve that, it takes long time in that vial, but in a lyophilized vial, it takes very short time. And most important thing, when you are pouring that, you have to have the same, say for example, 1 gram American, you are dissolving, you need to have that 1 gram back, so that can go into the system. So these are the things, and when you are preparing fast, you might not get that. And that had been one good study long time back in Germany, and that was published in Blue Journal, saying that these molecules, whatever we are using, if we don't give it in right dose, in a septic patient was in sepsis, and they have done in hamster, and they have shown that in many, they have taken molecules from different part of the world and all different, I won't say the name, and the product, if it is not in adequate dose with adequate purity, then that product can cause more harm. And that has been proved long time back. It was probably 1998 or something. So that has opened our mind and knowledge that we have to have a sounding system, and after that we are getting this lyophilized fire. So this is something I think is very good because they have the chamber lyophilized, and as you could see, dissolved instantly, and there is no difference, drawing and other things. So you get the exact dose. I think that is the best thing we are having. Next, we'll see the response of our patient.
I think because in all the cases, asepsis is not strictly maintained in our ICU in day-to-day practice. This is number one, and it cuts short the process of that is number two. Number three, it is made in India. So I hope that price will be reasonable so that Indian community can afford. That is my only hope to Gufic people.
Yes, we have demonstrated it earlier also, sir. Thank you.
Yeah, Dr. Shushuta Bandhavata, I have gone through the presentation and scientific basis of this product. Previously, a few years ago, there was again some similar researches going on. Who actually shown that in ICU there are many particles floating in the air, and that particles are basically having that the person is there's actually person in the problem fix that partially punctures the vial suffer once some fluid, he takes it out, shakes the vial, gives it to water. All these are the processes. This which is in the sleeve, making this particles they can come and moreover, by the number of times you use the meeting, so considering that self-seed or pre-filled and seed formulation, which can be just activated by pressure, is function. Only function when you actually are delivering the drug and you don't use medications. So that's just very important. I think that how close is that it does that is being made by an Indian company which have 85% of APIs produced by themselves in 2-3 years. Because we have been doing this right for us and packing on market. So those issues of we are doing a lot of China, so that was independent.
Sir, any question from your side? আপনাদের যদি কোনো প্রশ্ন থাকে you can ask in বাংলা also. কারণ এখানে আমার বস ছাড়া সবাই বাংলা।
আপনারা প্রাইস রেঞ্জটা কত রাখছেন? প্রাইস রেঞ্জটা মানে এটা তো বাইরে থেকে এতদিন আমদানি করা হতো, প্রচুর দাম পড়তো, সেইখানে এখানকার প্রাইসটা কত হচ্ছে?
Yes, I understood somehow. I'll try to answer in my right way and correct me if right. So yes, price. If you consider the price of a normal powdered vial which is available in the market, what's the same? It's not only the vial which has the powder. You need to have a needle, a syringe, a diluent, and you further need to have that big box. You need the transportation cost from going from the factory or warehousing to the distributor to the hospital, and then eventually the storage space. However, if you do a direct comparison also, initially our target is that around 15 to 20% will be the increase in cost of the conventional vial. We are hoping with economic scale. As any new technology, there's always an early adoption where the prices rise. In the next 2 to 3 years, we hope, and I think Christian and I, we both discuss it aggressively, that we hope in the next 3 years we can make it almost at par with the conventional. That's the effort. Did I answer your question right, sir?
Okay. Thank you, gentlemen, and the entire doctor fraternity. This is really remarkable where the secondary infection chances are there. From a GMP perspective, I'll ask few questions, especially to the manufacturers. What is the temperature range which can support? Because is India, and globally you have minus 40 degrees Siachen, also the plus 50 degree Thar desert. And our healthcare centers in the rural segments are not all the air conditioned. Number one, the cold chain scenario for the delivery of the drug, shelf life, all these things needs to be taken care of. Second, you mentioned that not only the vial injection and the tube, it reduces for the purchase and inventory managers. For one doses, you have to maintain 3-4 different inventory items. Here, only one inventory item can reduce the headache on the finance and other related things. It's a non-medical aspect, but very important aspect for hospital management. You have the vial, but you don't have the syringe. You have the vial and syringe, you don't have the tube, so you can't deliver. So it could be a game changer from that point. One unit is good enough to deliver the thing. Third important thing which I have found, just correct me doctors, sometimes it happens, the junior nurses who are just entering into the system in the learning process, it's very difficult for them. They forgot to push in the air from drawing before the vial, especially when you are taking the insulin daily. So you have to put the double the size of the air inside the vial to draw back, otherwise it will retract. Create the problem. So this kind of delivery mechanism, if you can bring for other drugs as well, so that will bring fortune to the people. And in case of combat situations, or where our boys are fighting in the borders, or any kind of emergency situations, this delivery system can be a very game changer and helpful to all the fraternities. They don't need that much experienced hands who can really draw the pool riding, break and the things. So their things is very important. If they are well, then only the medical system can be improved. So it's a very good. But my question is, in GMP perspective, are you maintaining Industry 4.0 or something like that?
So I think 3 wonderful points. I'll go one by one. I think the next 2 points are
Long question, sorry.
No. So I think I like it, sir. I really gives me confidence that you understood our product very well, and that's why the questions are wonderful. The first point made by Christian was we have a comparison of vial versus moisture. If you see a vial is a glass vial, it has only protection from moisture what we see. But in the end, it's a glass, has a rubber stopper, and it has a seal on it. Ideally, yes, it doesn't have any moisture thing, but we have seen in India because of the erratic, I would say, manufacturing practices from all 4 parts of India. There is always a chance that the moisture content in the vial always increases by at least 0.5 to 1.5% during the shelf. Here there is zero chance because it's completely closed. But even as Christian said, the foil itself has a PP layer, then it has a second layer, and then it has a foil layer. So vial doesn't have sun protection. A bag has sun protection. So we ensure that moisture, light, both is taken care of. The current vial, when we test the stability, we test it at let's take Neropetrim. Neropetrim is a product which is stored at room temperature below 25 degrees Celsius, depending on country and the specifications. We do at stability at also 40 degrees Celsius, which takes care of the transportation because somewhere is when temperature exertion happens. The same set of stability what we apply to a vial is applied to the bag. The advantage, and why Christian and I we both endorse, and Nadine also agrees because she's done this stability also. The stability in this bag, because of less moisture, no light, is much higher. Today a vial can be only 24 months. We are, like he said, right now we are giving 24 months, but in the next 6 to 8 months, our bags will be 36 months. So that will also give more flexibility in the time of the channel. Sometimes some inventory gets pushed, something is there. The expiry goes down. If the expiry goes down, then the load on the biological, the system, ecosystem also goes down. Second question, sir, you mentioned, which again you were endorsing, and I fully agree. We did a calculation. A nurse pre-pandemic, forget the pandemic part. The nursing staff was, salute them, salute the doctors because what they have gone through in the last
give a standing ovation
absolutely. I think in the end we should give them a standing ovation at the end of it because it has been not only physically draining but mentally much more draining. And they have been drained out. The nursing has been drained out. When you don't blame them since patients are coming out, you can't maintain these conditions. If we can give them a closed system, at the same time we can save their time. there's a lot of paperwork involved. Gone are the days where, okay, you just take care of the patient and you can get away with it. The amount of paperwork which has increased for the nursing staff and the entire medical fraternity has just gone up considerably. And if we can save, so we did a calculation, if depending on an average nurse and average number of ICU beds or hospital beds, a nurse can save 1.5 to 2 hours minimum per day, by which she can have time to eat a food or relax herself, call her well, she'll at the same time focus on the patient and do her documentation. That's a big load which we feel can be, which is all this is intangible, which we do. So yes, I agree. I think these are the 2 points which I wanted to bring out. Did I miss any points, sir?
No, that's very good.
Just regarding once we resolve this problem, sometimes you have to tell the say or next time. So how long we can keep it? So reason I'm telling you, say 1 gram, we have reserved oil. Sometimes it's kind of so use like if it is stable for 20 hours, because price come down and yes, we cannot waste something which is really for our. So how we can keep it?
Ideally, since we are almost reconstituting in the 100 ml very obviously, once it is acceptable broken, it has to be used within 1 hour. 1 hour. Because the advantage of the vial is.
One thing I tell you, Meropenem, they are giving
4 hours.
your 3 hours.
Yeah,
So
4 hours. My mistake, 4 hours.
Yeah.
My mistake, 4 hours.
4 hours.
4 hours and 4 hours.
It is 4 hours.
Actually, very frankly, sir, our stability is 8 hours. But we say 4 hours, very frankly, because different temperature conditions, like you also mentioned, sometimes the temperature of the ecosystem is rated around 40 degrees or something. At the time, we don't want to take a risk. So 8 hours, we have done a reconstitution of 0, 2, 4, 8 and 16. In some cases, if the temperature is around 20 degrees and below, even till 16 hours it was fine, but we will not recommend that because that's something
I request you to find out some ways because Meropenem, you are giving it to syringe for a period of say 3 hours. That's the standard practice. So these bags will be difficult for us. We have to buy it up in say 50cc syringe or any syringe. So that is, I think we can do it.
Yes.
We take infusion pump. Infusion pump we can adjust to advance another cost. So we have to see for
we will give it a
this
good
is
point.
practical point.
No, absolutely, good point.
Sir, it is not the question of Meropenem only. It is a
Yeah,
concept,
it is.
so we will be going for all the other products.
Sir, have you tested with accelerated aging and other things?
Absolutely. So when a complete pharmaceutical testing done for a period of 24 months and now ongoing for 36 months for all parameters of light, photo degradation, temperature, pressure, even the bag also has to. So now let's say bag is freshly made in 0 months. But when it goes to 24 months, does it require the same bar of pressure to open the septum or less bar of pressure to open the septum? And all the way to 36 months.
Permeability check and all.
Leaching, so that's the point where Christian again said. Leaching is something which is best. The glass still is an option of leaching. In this bag with this 3-layer protection plus the foil protection, there's almost, not almost, there is 0 chance of leaching.
Any further question from any of you? কোনো question আছে আর কারো? So thank you very much.
Compensate করে কি কোনো রকম
Thank you, doctors.